Bismillahirrahmanirrahim. Today my topic of presentation is smoking. Stop smoking. Cigarettes are killer that travel in packs. Learning objectives of today's presentation is introduction of smoking, types of smoking, components of tobacco smoking, types of tobacco use, health effects of cigarette smoking, smoking quitting, and smoking prevention and cessation, recent updates and MCQs. Learning outcome. By the end of this presentation, participants will be able to describe the introduction of smoking, various types of smoking, components of tobacco smoking, types of tobacco use, health effects of cigarette smoking, smoking quitting, smoking prevention and cessation strategies, recent updates. Introduction. Smoking is a practice in which a substance is burned and the resulting smoke breathed into the taste and absorbed into the bloodstream. Smoking is generally done with pipes and cigars. The practice is believed to have begun as early as 5,000 to 3,000 BC in Mesoamerica and South America. Tobacco was introduced in Eurasia in late 17th century by European colonists where it followed common trade route. Now types of smoking. Smoking are two types mainly, active smoking and passive smoking. Active smoking is the intentional inhalation of smoke using the method of smoking such as cigarettes or cigars. Passive smoking is also known as second-hand smoke and it is the inhalation of smoke by a person other than intended active smoker. Never smoker, adults who have never smoked a cigarette or who smoked fewer than 100 cigarettes in their entire lifetime. Former smoker, adults who have smoked at least 100 cigarettes in their lifetime but say they currently do not smoke. Non-smokers, adults who currently do not smoke cigarettes, including both former smokers and never smokers. Current smoker, adults who have smoked 100 cigarettes in their lifetime and currently smoke cigarettes every day or some day. What is tobacco? Tobacco is a plant grown for its leaves, which are dried and fermented before being put in tobacco product. Tobacco contains nicotine, which is an ingredient that leads to addiction. Tobacco smoking is in legal use everywhere in the world, yet it causes far more death than all other psychoactive substances combined. If we see 2021 key facts about tobacco, according to WHO, tobacco kills up to half of its users. Tobacco kills more than 8 million people each year. More than 7 million of these deaths are result of direct tobacco use, while 1.2 million are results of second-hand smoke. Over 80% of world's 1.3 billion tobacco users live in low and middle income countries. Toxic component of tobacco smoke. It consists of tar, which is the road surface, butane, ammonia, methanol, formaldehyde, cadmium, radon, hydrogen cyanide, which is a poison, arsenic, acetone, or nicotine and carbon monoxide. If we see the chemical component in the cigarette smoke, this graph shows our estimated number of chemical components in cigarette is 7,357 and 70 number of these compounds with confirmed carcinogenic activity. The component mainly are chemical component is nicotine, staldehyde, nitrosamines, butadiene, which is a non-human carcinogenic benzene, acrolein, polyaromatics or aromatics amine. Now the effects of nicotine. Nicotine is a stimulant which is present in smoke and is one of the main factors leading to continued tobacco smoking. When we smoke, then nicotine release, which facilitates dopamine release in the nucleus accumbens in the brain, and then it causes a pleasurable effect, and it further triggers positive reinforcement, and this lead to nicotine addiction. Chemical carcinogens. Tobacco smoke produce carcinogenic products, which leads to formation of epoxides, which irreversibly attach to cell's nuclear DNA and it causes the genetic mutation and cancer cell. About 69 carcinogens are identified in tobacco smoke. Among them, 11 are known as human carcinogen and 7 are probably carcinogenic in humans. Effect of carbon monoxide. In smoking, normally hemoglobin carries oxygen, but the smoking produces the carbon monoxide which form bonds with the hemoglobin and oxygen can no longer be carried. And therefore, the health effect of carbon monoxide saturation in the blood above 1% can cause detectable physical symptoms such as increased heart rate between 1 to 5%, reduced tolerance for exercise between 2 to 15%, headache and visual distortion can occur at a high level of carbon monoxide saturation in the blood between 15 to 20%. Cigarettes, what does tar go? Tar can do in the body. Cigarette smoke paralyzes or destroy the cilia, which are the fine hair that line your upper airways and help to protect against infection. When cilia are damaged, tar is able to penetrate further into your lung, where it can do even more damage. And immediate health effects from damage to lung include coughing and shortness of breath or tightness in the chest due to tar. Damage to the lung caused by smoking can lead to further complications due to tar such as emphysema. What are the various social causes which can associated with smoking initiation and continuous smoking? At individual level or interpersonal level, it may be age, gender, beliefs, race, genetic, socioeconomic status, attitude. At interpersonal level, it may be friends, co-workers, family and physicians. At community level, it may be school, healthcare system, workplace or media. At society or policy level, there may be education, advertising, smoke-free laws or taxes which may be associated with smoking initiation or continuous smoking. Types of tobacco use. Smoking tobacco. Tobacco smoking is the act of burning dried and cured leaves of tobacco plant and inhale the smoke. Combustion releases biochemically active compounds in tobacco such as nicotine and PSNA and allows them to be absorbed through lungs. It can be used as in the form of roll your own cigarettes or cigarette hand filled by smoker from fine cut loose tobacco rolled in a cigarette paper. It most prevalent in the Europe and New Zealand. Manufactured cigarettes are the most commonly consumed tobacco products worldwide. They consist of shredded or reconstituted tobacco processed with hundreds of chemicals, usually tipped with cellulose acetate filter. They are lit at the one and inhaled through the other. It is most prevalent worldwide. Cigars are the made of air cured and fermented tobacco with tobacco leaf wrapper. The long aging and fermentation process produce high concentration of carcinogenic compound that are released on combustion. It is most prevalent worldwide. Virus consists of small amount of sun-dried black tobacco hand wrapped in a dried tambourine or tento leaf and tied with string. Despite their small size, virus deliver more tar and carbon monoxide than manufactured cigarette. Because users are forced to puff harder to keep virus lit. It is mostly prevalent in South Asia. Caritakis are clove-flavored cigarettes mainly smoked in Indonesia. They may contain a wide range of exotic flavoring and eugenol, which has an anesthetic effect, allowing for deeper and more harmful smoke inhalation. It is mostly prevalent in Indonesia. Water pipes, also known as shisha, hookah, or nargile or hubble bubble, operate by water filtration and indirect heat. Flavored tobacco is burnt in a smoke bowl covered with foil and coal. The smoke is cooled by filtration through basin of water and consumed through hose and mouthpiece. It is mostly prevalent in North Africa, Mediterranean region, and parts of Asia. Pipes are made by slate, clay, or other substance. Tobacco is placed in the bowl and smoke is inhaled through stem. In Southeast Asia, clay pipe known as sulfa, chilium, and hukli are widely used. Sticks are made from sun-cured tobacco wrapped in cigarette paper, for example, hand-rolled bars. It is most common in Papua New Guinea. Smokeless tobacco. Smokeless tobacco is usually consumed orally or nasally without burning or combustion. There are two main types of smokers: smokeless tobacco, snuff and chewing tobacco. Moist snuff is small amount of ground tobacco held in the mouth between cheek and gum. Dry sniff is powdered tobacco that is inhaled through nose and absorbed through nasal mucosa. Chewing tobacco. Oral smokeless tobacco products are placed in mouth, cheek, or inner lip and sucked and chewed. Tobacco paste or powder similarly used placed on the gums, uh, sometimes referred to as spit tobacco. It is most commonly prevalent in India. There is also the e-cigarette which are provide the nicotine through aerosol instead of through smoke as with the tobacco cigarette. Puffing on the mouthpiece of cartridge activates a battery powered device. A heater then converts a liquid solution which contains nicotine, flavors and other chemical into aerosol commonly called vapor that the user inhale. The act of inhaling this aerosol solution is sometimes called vaping. It includes a cartridge which contains a solution liquid made up of glycol, glycerol, water, or nicotine. Vaporizer heating device that turns the liquid solution into aerosol called vapor which can be inhaled, and it is the battery that powers the device. There is a myth that electronic cigarettes are safe and don't have any toxin, but in reality, electronic cigarettes deliver nicotine and low levels of toxin and chemical, and many of the same chemical found in tobacco. Now, health effects of cigarette smoke. The cigarette affect almost every part of the body, include mouth and pharynx, lungs. It can cause bronchitis, emphysema, heart, coronary artery disease, esophagus and stomach cancer and peptic ulcer, pancreas cancer, bladder cancer, uterus and ovaries infertility, spontaneous abortion, testes reduced fertility, peripheral artery disease, bone. It causes osteoporosis. One cause chronic disease such as stroke, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, coronary lung disease, asthma, reduced fertility, hip fracture, cervix, cancer of cervix, bladder, colon, pancreas, kidneys, stomach, leukemia, lung, head or neck cancer. Smoking and death. Cigarette smoke is leading cause of preventable death in United States. Smoking causes more death even each year than the causes combined. As compared to HIV, illegal drug use, alcohol use, motor vehicle accident, or firearm related accidents. Smoking causes about 90% of all lung cancer death. Smoking causes about 80% out 10 out of 8 of all deaths from chronic obstructive pulmonary disease. Smoking and cardiovascular system. Smoking causes stroke and coronary heart disease and the leading cause of death in United States. Smoking damages the blood vessels. It becomes thicker, narrow, heartbeat increase, blood pressure increase, and it can cause clot. Respiratory disease. Cigarette smoking is responsible for 90% of COPD, chronic mucosal hyperplasia of larger airways resulting in chronic productive cough as in many as 80% of smokers more than 60 years. COPD caused by smoking is permanent incurable reduction of pulmonary capacity characterized by shortness of breath, wheezing, persistent cough with sputum, damage to the lungs, including emphysema and chronic bronchitis. Smoking long-term exposure lead to carbon monoxide and cyanide, chronic inflammation and narrowing of small airways, pulmonary damage and loss of elasticity in the alveoli. It can lead to emphysema and COPD and reduced expiratory airflow. Changes in the small airways of young smokers will reverse after 1 to 2 years of cessation. It can and also cause cancer. Female infertility is also leads to harmful for ovaries because it interferes with body ability to create estrogen, affects folliculogenesis and ovulation, and cause female infertility. Smoking and other health risk fact, it can also lead to preterm early delivery, stillbirth, low birth weight baby, sudden infant death syndrome, ectopic pregnancy, orofacial cleft in infants, miscarriage, affects the health of your teeth and gums and cause tooth loss, can cause cataract. Smoking is a cause of type 2 diabetes and can make it harder to control. It can cause general adverse effects including inflammation and decreased immune system. Stress. Smokers report higher levels of everyday stress. Effects of nutrition. Smoking drains the body of essential vitamins and minerals and also block absorption of these nutrients including antioxidant. Vitamin D which aids in calcium absorption is affected by smoking. Smokers are high risk for developing osteoporosis. Health risk for family members, second-hand smoke, spouses and children are increased risk of cancer and heart disease. Babies whose parents smoke are more likely to have ear infection, pneumonia, bronchitis in their first year of life and have high risk of developing sudden infant death syndrome. Coronary artery disease, smoking causes blood clots to clump with a high risk to form clot, can cause spasm in the coronary artery, which can reduce blood flow to the heart, lowers HDL or good cholesterol. Problems with pregnancy. Women who smoke are more likely to have the following problems: stillbirths and miscarriage, low birth weight, children who have learning emotional behavior problems. Smoking quitting. Health benefits of quitting smoking include improves health and increases life expectancy, lower risk of 12 types of cancer, lower risk of cardiovascular disease, lower risk of coronary COPD, lower the risk of some other reproductive health problems. Benefit who have already been diagnosed with coronary heart disease, benefit at any age, even people who have smoked for years or who have smoked heavily will benefit from quitting. Quitting lowers the 12 types of cancer. Time after quitting, after minutes heart rate drops, 12 hours nicotine level in the blood drops to zero. After several days, carbon monoxide level in the blood drops to level of someone who does not smoke. After 1 to 12 months, coughing and shortness of breath decrease. After 1 to 12 years, 1 to 2 years, risk of heart attack drops sharply. 3 to 6 years, added risk of coronary heart disease drops by half. After 5 to 10 years, added risk of cancer of mouth, throat, and voice box drops by half risk of stroke. After 10 years, added risk of lung cancer drops by half after 10 to 15 years. After 15 years of smoking quitting, risk of coronary heart disease drops to close to that of someone who does not smoke. And after 20 years, risk of cancer of mouth, throat, and voice box to closer to that someone who does not smoke. There are many plans and strategies for helping people to quit smoke. And let's start with start. Start as stand for set up quit date. Steve, tell family, friends, and co-worker that you plan to quit. A. Anticipate and plan for challenges you will face while quitting. R. Remove cigarette and other tobacco products and trigger from your home, car, and work. T. Talk to your doctor about getting help to quit. Quitting is a process. It may should be asked for support, make a quit plan, call a smoker hotline, identify triggers, explore prescription options. Quitting is a process and you should make a list to reason quit to throw away all tobacco, reward yourself for selection, keep trying. There were 5 Ds for quitting. Delay, urge, craving will pass. Drink plenty of water, distract yourself, deep breathing, discuss feeling with a friend or medical provider. 2 hours for quitting. Remind, go over your reason to quit, refuse, think it is not that you can smoke, it is that you don't want to smoke. There are 5 stages trans theoretical model which is used in stages of change of quitting smoking. First is pre-contemplation. No attention can be changing the behavior. Then contemplation where a problem exists but no commitment to action. Then preparation. Intent can taking action to address the problem. Then action, active modification of behavior. Then maintenance, sustained change, and then relapse, fall back into old pattern of behavior, and then pre-contemplation. It can upward spiral, learn from each relapse. Model for treatment of tobacco use and dependence. In general population, you can screen patient present to healthcare setting. Then you ask screen all parent patients for tobacco use, whether they are non-smoke, non-user, then primary prevention, then current user advice to quit. Then assess willingness to quit, assist with quitting, arrange or follow up. If assess willingness, there is no willing promote motivation to quit. And if a patient now willing to quit, then assist with quitting. And then if there is abstinence, arrange follow up. And if there is a lapse, also advise to quit and prevent relapse. Withdrawal symptom, there may be withdrawal symptom and we can overcome. For example, craving for smoke most intense in first week. Wait for a distract yourself, take a brisk walk. Irritable or short temper 2 to 4 weeks. Duration, exercise, take hot baths, use relaxation techniques, avoid caffeine. Sleeplessness for 2 to 4 weeks. Avoid caffeine after 6 p.m. Use relaxation technique, exercise, plan activities. Tiredness 2 to 4 weeks. Take naps, don't push yourself. Lack of focus, poor memory a few weeks. Reduce workload, avoid stress. Hunger several weeks or longer. Drink water, low calorie drinks. Eat low calorie snack. Respiratory system, cough, dry throat, maybe duration several weeks. Drink plenty of water. Use cough drops. Indigestion, constipation, bloated stomach 1 to 2 weeks. Drink plenty of fluids and fiber to diet exercise. There are two A's for 30-second intervention include ask about smoking, systematically identify all tobacco users at every visit, act to help all tobacco users quit. 5 A's, 5-minute ask about smoking, systematically advise on the benefits of cessation, eight, assess motivation to quit, assist, stop attempts, arrange follow-up schedule. Pharmacological intervention include nicotine replacement therapy, include rates of quitting 17.6%. It can be used nicotine patch, nicotine gum, nicotine nasal spray, nicotine inhaler. Bupropion rates of quitting is 9.1%. Varenicline, its rates of quitting is 27.6%. It is most effective anti-smoking drug. Smoking prevention and cessation. According to level of prevention, it includes primary prevention, strategies to prevent people from start smoking, bans of smoking in public places, bans of tobacco marketing, health promotion in the form of education about the danger for smoking and anti-smoking campaigns. Secondary prevention include intervention to help people stop smoking cessation such as nicotine replacement and therapy and treatment. Examine prevention strategies and treatment behavior, substance abuse and addiction therapy. Cigarette smoking risk factors, there's precancerous lesion and molecular lesion and then develop to lung cancer. Screening include early detection and diagnosis and surveillance for recurrence after treatment. There may be primary trials of chemo prevention. There may be primary prevention, secondary. There may be trials of chemo prevention, smoking cessation, and tertiary. There is a pyramid model of smoking cessation and different levels of care. First, in general population, there should be health promotion, public health campaigns, public health policy, education for health. At first level of primary prevention, ask about tobacco use, advise tobacco users to stop, timely diagnosis of smoking, brief advice to stop smoking, in secondary level or secondary prevention ask about tobacco use and to advise tobacco users to stop, brief advice to stop smoking, pharmacological treatment intervention, motivational interview, smoking cessation clinic. Third level, which is interventional, brief advice to stop smoking, pharmacological intervention, nicotine replacement therapy, pharmacological treatment, smoking cessation clinic, basic clinical and applied research. Now, recent updates. WHO response. The scale of human and economic target tragedy that tobacco imposes is shocking. In 2003, WHO member states adopted the WHO framework session on tobacco control. Strengthening implementation of treaties specifically included in 2030 Agenda for Sustainable Development Goal as Target 3.8. In 2007, WHO introduced a practical, cost-effective way to scale up in the implementation of main demand reduction provision of WHO FCTC on the ground. Empower each empower measure corresponds to at least one provision of WHO Framework Convention on Tobacco Control. Six empower measures are M. Monitor tobacco use and prevention policy. P. Protect people for tobacco use. Offer people to warn about dangers of tobacco. E. Enforce ban on tobacco advertising, promotion, and sponsorship. R. Raise tax on tobacco. WHO has also monitored Empower policy since 2007. WHO report on global tobacco epidemic 2020 tell about new and emerging products in a series of WHO reports. The protocol to eliminate illicit trade in tobacco products require a wide range of measures relating to the tobacco supply chain, including the licensing of import, export, and manufacture of tobacco products. WHO also celebrated World No Tobacco Day around the year on around the year May 31st. This yearly celebration informs the public on danger of using tobacco business practices of tobacco companies. WHO report and trends in the prevalence of tobacco use 2000 to 2025 third edition, which tell about progress in tobacco use is key indicator for measuring countries' effort to implement WHO framework. And it adopted to report progress toward SDG target 3 A and tobacco reduction target under the Global Action Plan for Prevention and Control of non-communicable disease. This report presents WHO estimate of tobacco usage prevalence, number of user changes between 2018 and projected to 2025. And it shows that, according to this report, trends in the prevalence of tobacco use at global level in 2000, around a third 33.3% of global population, both genders combined and age 15 years and older, were current users of some form of tobacco. By 2015, this rate had declined to about quarter of the global population, and assuming that current efforts in tobacco control are maintained in all countries, the rate is projected to decline further to about fifth or 20% of global population by 2025. In 2000, it is in male 50% prevalence, in both gender 33%, and female 16%. And it is projected to decline further to about 20% in the 2025. At its projected population levels of tobacco use in cigarette smoke, working towards tobacco-free world, there's WHO framework. Objective is prevent and future generations from devastating health and social effects. Working towards tobacco-free framework, there's a WHO framework on tobacco control. The article is published tobacco smoking highlighted quality of life among university students, mediating effect of depression, and it shows that the student this result showed that the smoking was associated with poor mental composite score and physical composite score, and a higher BDI or depression was associated with poor physical composite score and mental composite score. The association of smoking with impairment of health-related quality of life. These findings highlight further research on interaction between smoking, mental health, and quality of life. Article published effect of tobacco smoking and risk of developing community-acquired pneumonia, systematic meta-analysis. This result showed that 647 studies identified, 27 were included, and most of included studies were moderate quality, and meta-analysis showed that current smoker and ex-smoker were more likely to develop community-acquired pneumonia compared to never smoker, and aged more than 65 who were passive smokers are also at high risk of community-acquired pneumonia. The impact of COVID-19 and smoking pattern in Pakistan, finding from longitudinal survey, that this study showed that the study recruited the 6,014 smokers between September 2019, before COVID-19, and after COVID-19, and 2087 studies were followed in May 2020. Since COVID-19, 40% more reported smoking. Among those who continued smoking, 68% maintained, and 18% increased cigarette consumption, reported at least one quit attempt. Changes in smoking patterns varied with nicotine dependence, motivation to quit, and financial stability since COVID-19. This study shows significant bidirectional change in smoking patterns since COVID-19 in Pakistan. Although many people stopped, reduced, or tried smoking, some increased smoking and some relapsed after quitting. Now time for MCQs. MCQs 1. A 30 years old Mr. Ali is recently diagnosed with chronic obstructive lung disease. He is currently working in transportation company where cigarette smoke is not regulated at higher level. The most likely cause of his disease is due to active smoking, cigar smoking, electronic smoking, passive smoking, or shisha smoking.
D.
Delta, yes, answer passive, because in his workplace there is no there's no strategies or of prevention the smoke. Therefore, it's a passive smoking. MCQs 2. Mr. Akbar, 50 years old, presented in medical outpatient department with symptoms of shortness of breath after even mild forms of exercise like walking up a flight of stairs, chest tightness, chronic cough. For last 2 years, he gave the history of cigarette smoke for last 25 years. The most likely cause of his symptom is due to A. Chronic obstructive lung disease, chronic liver disease, chronic heart disease, bone disease, or chronic gastric.
A.
Yes, chronic obstructive disease. He is smoker at for last 25 years, and all symptoms are lead towards chronic obstructive lung disease. So correct answer is alpha. MCQ3. Mr. Umar, 55 years old, presented recently diagnosed with emphysema. He is also a chronic smoker and has smoked cigarette for last 15 years. What is most likely component of tobacco smoke responsible for its development of emphysema? Carbon dioxide, monoxide, nicotine, radon, or tar?
C.
E. Tar is mostly responsible for development of emphysema and because it damages the cilia. MCQs 4. A public health team investigated the increased cause of death due to increased usage of tobacco smoking among adults and middle-aged people in the ABC community. According to findings, smoking causes about 80% of death due to chronic obstructive lung disease, chronic liver disease, heart disease, bone disease, or gastrointestinal disease.
A.
Alpha. COPD is responsible for 80% of death in smokers. Mr. Asghar, 40 years, working in construction company, presented in outpatient department with occasional shortness of breath, especially after exercise, increase in heart rate, headache, and visual disturbance for last 3 months. He gave the history of cigarette smoke for last 15 years. What is most likely component of tobacco smoke responsible for its development of symptoms? Carbon dioxide, monoxide, nicotine, radon, or tar. Beta is correct answer, carbon monoxide, because when there is increased ratio, decreased saturation of oxygen, then these symptoms appear. MCQ 6. Miss Shubhana, 30 years old, female, 10 weeks pregnant, chronic smoker for last 10 years, presented in gynecological and OPS clinic for a routine medical checkup. Her consultant advised her to quit smoking during pregnancy. She will have the increased risk of following medical problem during pregnancy if she not quit smoking: back pain, indigestion and heartburn, stillbirth and miscarriage, swelling of finger, face and leg, urinary tract infection.
Stillbirths and miscarriages.
C is correct answer, because as she is pregnant and smoking leads to stillbirth and miscarriage. MCQ 7. Mr. Zahid, 58 years old, male, former smoker, is currently taking treatment for quitting tobacco smoking in the Drug Addiction Treatment and Rehabilitation Center for last 2 years. After quitting smoking, Mr. Zahid's risk of coronary heart disease dropped to close to that of someone who does not smoke after dash years. 5 years, 10 years, 15 years, 20 years, or 25 years. C is the
10
correct
years?
answer. C is the correct
Oh.
answer. After 15 years, risk of coronary artery disease dropped to close that of someone who does not smoke. MCQs 8. Mr. Osama, 45 years old male, a current smoker for last 20 years, presented in emergency with symptom of chest pain, discomfort, weakness, lightheadedness, nausea, cold sweat, and pain in the left arm for last 2 days. The most likely cause of his symptom is acute coronary disease, bronchitis, emphysema, laryngitis, or pneumonia.
A.
Alpha. Yes, these are all symptoms of chest pain, acute coronary disease, and it is also and a risk factor for this is chronic smoker. Therefore, alpha is correct answer. MCQs 9. Mr. Jamshed, a 65 years old male, a current smoker for last 30 years, presented in surgical emergency with hip fracture after fall. The most likely cause of his fracture is due to fibrous dysplasia, osteoarthritis, osteoporosis, rheumatoid arthritis, rickets.
C.
C.
Yes, C is correct answer. Osteoporosis, as in smoker, there is decreased bone mass, and also there is also decreased absorption of vitamin D and calcium, which leads to bone weakness, and there is more chances of osteoporosis, which can lead to fracture in the smoker. Therefore, the correct answer is C, osteoporosis. MCQs 10. Mr. Naveed, a 60 years or 2 years old male, current smoker for last 25 years, visited the Drug Treatment and Rehabilitation Center to take treatment for quitting smoking. Which of the following anti-smoking drug is the most effective for him? Bupropion SRC, nicotine gum, nicotine nasal spray, nicotine skin patch, or vernicillin?
C.
Ivermectin is most effective. According to literature and I told, anti-smoking drug is effective for him. Therefore, E is the correct answer. This is the key of MCQs, references, and then thank you.